You go first.
Bailey, MBS LPN.
Marion Griffin, LPN.
Bonnie Randalls, RN Unit Manager.
Kate Partridge, RN Unit Manager.
Jamaica Harrison, RN Unit Manager.
Okay.
Alright, you guys see that pretty good? My name's Antoinette. I'm a BSN RN BSN student, and I'm doing this presentation on mental health following the global pandemic. After this presentation, you guys will be able to name about 3 effects of COVID had on the community, everyone pretty much in the world. And you'll be able to name 3 groups of people. I kind of highlighted a few groups of people to focus on during this presentation. And you'll be able to also name 3 ways to help cope with those mental issues that we're all dealing with during this COVID-19 mental health issues, and 3 resources that you guys will be able to research, look up to help pass along to those who need additional information on how to cope and deal with the mental health during the COVID-19 pandemic. The effects of COVID-19 has been taking a toll on everyone. A lot of people have had increased depression, anxiety, stress overall, and that equal up to physiological distress. Some people have had post-traumatic stress issues going on, appetite changes, sleep changes, things like that. When we have had decrease in exercise, that takes a toll on us physically and mentally as well. And some people use alcohol and drugs to kind of cope, which is not so good as well during the pandemic. This is just a statistic here I got from CDC website. They did this statistic back, you can see this part back in June of last year, 2020, and it says 40% of adults actually have been struggling with issues with mental health or substance abuse, things like that. All right, so who is affected? Adolescents are affected, people with disabilities like autism and learning disabilities are affected, healthcare workers are affected, and the elderly population is extremely affected by the COVID-19 pandemic. Adolescents, they are very social, during their school year time. They are very close knitted with their peers and everything. So with the COVID-19, not being able to go to school, not being able to go around their friends, and not being able to attend school functions has really been a toll on them. People with autism and learning disabilities, they have a structured environment. A lot of times they have a schedule that they follow every day, so that's been disrupted by the COVID-19. The elderly population, we try to promote being physical, and moving around for their health and everything like that. But since the COVID-19, a lot of things has changed with them having to be inside, not being able to be around their family, things like that. Healthcare workers, they work real close with the patients. They are very at risk for catching COVID-19 and seeing all the stress that come along with COVID-19. They have been really affected by the COVID-19 pandemic. So what we're gonna do to cope with the COVID-19 pandemic? First off, we have to take time for ourselves, be able to sit down and get some sleep. Sit down and eat healthy, because grab and goes is not always good and healthy for us. Limited time on social media. With the adolescents, they are always on social media, and at that time, it's actually become a problem having them increase depression, anxiety, and suicide ideations, because they're constantly on social media and everything, and some of them even try to commit suicide on social media. And for those reasons, taking time out away from the news, taking time out away from social media is a good way of helping decrease that stress and anxiety from the COVID-19 pandemic. talking to your friends and your family, becoming active, taking time out for yourself. It's a good way of taking care of yourself so keep your peace of mind going throughout this pandemic, because we all are needed in this pandemic to keep everybody else going as well. It becomes to a point to where it's becoming too overwhelming. We have to seek help. We have to make us our appointment with the therapist and talk about it and get some help when the time comes if it gets too overwhelming. This is just a reminder to take care of yourself during the stressful times with the COVID-19. And who we're gonna call? I like the little caption. Because healthcare matters. You have different resources. You got the crisis helpline. You can text to the crisis helpline to get help. You can reach out to the CDC website. Employers, a lot of employers help nurses and the healthcare workers have, make appointments, and there a lot of times are free to have make appointments to seek help for your mental health. And school, or if you're in school, colleges also support the mental health by allowing you to have 3 office visits to a therapist if that's needed to help out. And there are some resources. And that's the end of my PowerPoint.